record it. Carrie's got the handle on that. We allowed 2 hours for this meeting so that we could talk about CARES Act recommendations for the almost 25 million that we've been working on for the last couple of weeks. And I just wanted to ask, before we get into that, is there anything pressing recovery-wise that we need to put on the table this morning, or that anybody needs to bring attention to in addition to this CARES Act money? Okay, not seeing or hearing anything. I'm going to turn it over to Sarah. Are you ready? All right. Thank you, Sarah.
Hey guys, thank you. So earlier today, you were sent an email with a series of spreadsheets working through the CARES Act funding. We are going to try to walk through them here in this 2-hour meeting and, you know, kind of make it through it. We're going to try to keep an eye on time, and I think we can take some questions on the way, but we may have to stop and kind of move on if we need to get through all the RSFs, because I want to make sure every RSF has time to be discussed today. I would also say we're going to start off by talking about the reimbursements and the direct aid requests that this team didn't formally see, but you just need to know where we're at on those. And before I pull up the first spreadsheet, I'll talk a little bit about process and then give you some overall remarks. In terms of process, what I think would work best is Brooke and I will take the direct aid plans and the reimbursements and kind of quickly walk people through that and our philosophy on that. And then my intent would be to go RSF 1 through 4. If RSF 1, if the RSF leaders could just do, if there's any introductory remarks you want to say them, we'll pop up the sheets. And then from when those folks, like in that case, Diane and Steve, turned it over to the county, in that situation, Jasmine Moore and Daviana Humble in our office then helped create the county ranking or the county recommendation for it, and we can discuss that. So there might be multiple groups of people working on it, like RSF 2, that was Beth and Tracy, but then I did the sorting and recommendation on it. Jill was here for all of it for hers. So for RSF 3, and then for RSF 4, that was led by Julie and Andrew, but then Robert and Jillian helped with the sorting on that one. Does that make sense? So here's what I will say. This is rough. This is a rough cut. I'm not happy with where we are. This is probably the roughest draft I've ever put in front of a group of distinguished individuals such as yourselves. So I know there are things that will need to be modified and changed as a result of this. Literally, we received direct aid requests yesterday morning, and we received, and so we've had a ton of work to do, and there are some holes and gaps. So please be gentle with us as we talk through this process. There's still time to work on this to get it right. So this is really, at this point, what we will come together today. We've got a little bit of time to work on things between now and tomorrow, and then we will show it to the commission. They're not adopting anything tomorrow. We have a whole nother week before anything's adopted. So I know that there'll be edits and things, and you know, City of Lawrence may say, wait, like, we need to really make sure we change this thing around. I'll say, great, we got to know, we'll get back at it. So please just know that this is a first draft. Is that fair? Okay, so I'm going to share my screen. Can you all see this document that starts with CRF allocation, reimbursement requests? Thank you. Okay, so you see here, the first line is the beginning balance of what we were allocated. We have a column here for the amount requested, and then we have a column for the amount recommended. That recommendation right now is a combination of what came from RSFs, if it's an RSF, and from county staff. So that's about as firm as pudding in my view, in this place. So these are the individual reimbursements from public entities that we received. And I'm going to talk through them and discuss this. So one of the first things we discovered is really different views of how payroll should be looked at for reimbursements. Payroll for public entities is an eligible expense, but I want to be real clear here. I should probably have said this before we jumped into it. We received over 50 million in requests. So part of what happened yesterday is that we had to cut this in half. So we made some very difficult choices, and they're not final, and we can certainly come back and look at them again. So one of the first areas that we decided to talk about was payroll for public staff engaged in the event. And we divided it into categories: payroll for city county staff, payroll for school district employees, and payroll for health providers. We made a decision for this recommendation to not include payroll for cities and counties. The only entity that submitted payroll was the city of Lawrence. So, and it was a huge chunk, and as you can see, the request was 914,000, and right now it sits at 302. I know that's something the city manager and I can talk about offline, but please know that everything we add back in, I got to find some place to cut. There were no other payroll received from Douglas County, Eudora, Baldwin, or Lecompton. For school districts, really the only payroll, there were two payroll things included. One district included the gap on their food service workers that was not covered by the federal government for the food service work. And one school district covered some hazard pay. That was, we could also reduce those. So Eudora included some hazard pay, and then USD 497 had some food service workers. So I'd like to have everyone, I mean, I'd be interested in people's comments. And then I do think we can discuss this more. But this was our starting off point. We did not receive any reimbursement requests from the University of Kansas or Heartland Health, because as a federally qualified health center, the federal government covered all of their reimbursement needs. We did have payroll expenses for public health and LMH health, and those are included. I can go, you on your tabs have the detail in the order that we need them, so you're certainly welcome to flip through that if you want to, and I'm certainly willing to take conversations offline. Are there any questions on reimbursements before I jump to direct aid? All right, I'll move on. So then we looked at direct aid requests from municipalities that did not go through an RSF process. So Douglas County, City of Lawrence, City of Eudora, and Baldwin City and Grant Township submitted direct aid plans. Douglas County's direct aid plan was originally 11.1 million. We reduced it to 960,000. There was a significant amount in that direct aid plan related to capital improvements needed to secure public health at the jail. And I will advocate very strongly for that need, but I think the county can come up with other resources to make that happen. And not necessarily, they're totally CARES Act eligible expenses, but we pulled them out at this stage. And you guys have that detail. So I'm not going to show it on the screen, but you guys all have a tab that should show Douglas County's direct aid plan. The City of Lawrence's direct aid plan, we did not make any modifications to at this time. Here's where I want to talk about, there's a couple of themes where I feel like we still have some open issues that I'm not quite sure how we want to do this. And one of them is on all the HVAC and building UV system needs. City of Lawrence put in for quite a large chunk of that. We have a small piece for 2 buildings in Douglas counties. Number of school districts did them. I just say, like, I don't know if we're all using the right CDC science stuff or not. Not compared prices. I do think there will be some conversation about that. That's a big chunk that I felt like we either need to have a consistent approach on that, or the commissioners may want a consistent approach on that. Right now, that's all in. I mean, we haven't really modified any of that out. I do think that I had a conversation yesterday on the part of the City of Lawrence's plan related to a really interesting initiative related to starting some more community-based work on equity. And I had a great conversation with Casey about that. We're trying to go through each of these requests and make sure that they're really tied to COVID. So our latest call with the state on how to expend these funds, if it is not tied to COVID, they're kicking it out. So where we can, we may ask you to go back and revise a request to make sure that it's very tied to COVID. They specifically said, just because you wanted to do this for years and you never had the money to make it happen, that's not what this money's for. This money has to be tied to COVID. So just want you to know that we are trying to review those to make sure that they're consistent for that. City of Eudora had a pretty large program as well. I will tell you, I feel like I need a little more time on Eudora's. I have not had time to have a conversation with the city manager to make sure that this is, but the largest piece of theirs is a pretty large utilities economic support plan, which is similar to what the City of Lawrence did. So I kind of feel like if we're putting both of those in, we just need to put them both in. And then Eudora does have a Eudora business program that's included in theirs. So that could have easily, to me, been included in RSF1, but they put it in their direct aid plan. So those are the 2 biggest chunks of the City of Eudora plan. City of Baldwin City had a very small request, really just a little bit of sanitation and PPE, and then their portion of a digital libraries initiative that is the City of Lawrence Library, Eudora Library, and Baldwin Library are all doing together, and it's a digital equity project. So that's a small piece of theirs. Grant Township asked for quite a bit of money. Right now, we cut it out. It really does, and I'm not sure I'm going to be able to cut the whole thing out. Some pieces of it might come back in. They asked for significant improvements to their township hall, and they have a tenant that's a school. So that complicates matters. So, but at this point in time, we just rejected all of it just because I wasn't sure how much I could really tie to COVID and that need. But I will need to have a conversation with Grant Township as well. So I feel like, yeah, and Brooke's right. There's an error in the formula on Baldwin. We're about 2,000 off. So it will go up by 2,000. I feel like I need to stop here before we dive into RSF1. And I'm gonna stop sharing for that. And I wanna, before we dive into the RSFs, I want to share a document which I have shared with the Board of County Commissioners for their review. Yeah, here we go. When they make these decisions. So we took, before we jump into, we gave them some strategies for prioritization. There were just some countywide strategies, real open-ended. We cut administration and overhead to 5% on all projects that we could determine. We have been told by the state of Kansas that that's what they will accept. So we're at 5% for admin overhead. And so if we will go through the proposals again to make sure that we're being consistent on that. That's the big thing. The notion too on future federal and state funding, as you all know, that's a moving target. So we did the best we could, but I think we've got a lot of work to do in education to see if we can determine what's coming down the pike for some of those things, and not. And then for each of the RSFs, we included what RSF 1, 2, and 3 really did a great job of upfront stating what their prioritization metrics were going to be. So I've just included, cut and pasted those from the documents, and moved them in and shared that with the commission. I do feel like with RSF 1, we had to take some, I believe their highs that were recommended were in the neighborhood of, they had a total of 11 million in requests. I think their highs were 3 million. Diane, does that sound right?
3.5 million.
Okay, so we felt like we had to further cut it down to 1.2, really based off of trying to meet the needs of health and medical and housing and human services. I know RSF 1 is not where I want it to be. We need to come in and use a scalpel, not a, what's that term? You know, you don't want to use a machete when you can use a scalpel. Right now, some of this reflects a machete without a scalpel. I'd like to go back through and be a little bit more precise on some of that, and we can talk through it. With that, I can quit sharing my screen. And if you want, Diane, we could even have Daviana and Jasmine could throw up the RSF1 document, and while you're talking about what you guys went through with your process.
Sure, happy to do that, and I'll lead off. And I think I see Steve on the call, and I'm sure Jasmine's on the call. I couldn't hadn't have a chance to see everyone, but feel free to jump in. So let me just recap our process really quickly. We did try and do a lot of outreach in our group, getting information out. We did a couple of webinars, so I really appreciate Sarah, you participating in those and being available to help us answer questions, as well as Brooke. I really want to thank both of you. You all have had a lot of work to do, and then there's been further work I see by Daviana and Jasmine on their work in putting this together. So I haven't had a chance to digest this new summary here, so I'll just speak for what our group put together. Our timeline was very brief, and so I would say that our recommendations probably did need the scalpel kind of approach, because it probably does need to have some more refinement and looking more closely at the requests, which we figured the county would do. Our deadline was just last Thursday at noon, so we had very little time to get this turned around, and we wanted to get it to the county as soon as possible, which we did on Saturday morning. So very high level, we ended up receiving 73 applications through our process. We did receive a little bit over $11 million in requests. And these kind of ranged from your typical business type of requests that we would have predicted, to some that maybe would have been a better fit because of what they were requesting through another RSF. And we did try and highlight those, and they're actually shown here in blue on this spreadsheet, things that probably could have been a better match to go through another RSF. For example, the Ladybird Community Kitchen, that's your first one there. Although Ladybird is a traditional business, what she was requesting here had to do with their free food service program that they've been operating. So it wasn't necessarily a business related expense. But nonetheless, we forwarded all of the requests and tried to rank all of them that we received. And just kind of to break down the little over 11 million in requests that we did receive, we had, oh, before I do that, let me just cover the ranking criteria and how we went about that. So we tried to use, be very data driven in what we were recommending through our RSF, trying to recognize that the hardest hit sectors of due to COVID-19 are accommodations and food services, the arts, entertainment and recreation, personal services, things like barbershops as an example, and retail trade. And that these are the same sectors that will likely take the longest to recover. We also wanted to recognize that small businesses under 100 employees have been the most hard hit with COVID-19. And of particular concern to our RSF were locally owned and operated businesses. And the reason with that concern is those are really the kind of unique businesses that make Douglas County and our communities unique, and may not have a larger backstop of a larger organization, a national chain to support themselves through this time. We also wanted to place a high priority on applications with a very direct tie to expenses related to COVID-19. So we know that there's a lot of regular losses of business operation revenue that are associated with COVID-19, and that is certainly an eligible expense, but we wanted to particularly prioritize things that were related to either personal protective equipment expenses, physical modifications of work areas like installation of plexiglass equipment and supplies for monitoring symptoms of employees and customers, and expenses for special cleaning and additional cleaning related to COVID-19, and training and retraining expenses related to employees. And we also wanted to infuse equity into this, utilizing the worksheets that the equity team put together. And Jasmine and Paula were a great asset to our team in helping us through every step of this and asking the question, will this advance equity? So it was kind of those four criteria that went into what our rankings were. And it ended up that we had of the a little over 11 million, those that ended up ranking high, that is, those that tended to answer affirmatively to all of those 5 questions. They were an affected sector, they were a small business, they were locally owned and operated, they were submitting expenses that were very closely tied to COVID, not just operating expense loss, and whether they advanced equity or not. Those highs were about 3.5 million. The mediums were 4.1 million and the low 2.8 million. We did have 7 of the 73 requests submitted that we deemed ineligible. That was about 580,000 worth. Unfortunately, 6 of those 7 just simply did not fill out the equity form, which is what made them ineligible. And then 1 of them did submit something that we just deemed an ineligible expense, and it wasn't close. It wasn't really tied to COVID, and we questioned whether it was even eligible. So that gives you a very broad summary of what our recommendations were. And again, I'm interested to see how you all stratified it from here. And I'll ask if Steve or Jasmine or others from our group might have additional comments.
Diane, this is Steve. And I think you did an excellent job of covering. I guess one additional comment, and it's kind of in support of what Diane had mentioned. I think because our group was probably the last one with the deadline, or our deadline was the latest of any of the groups. And then I think also we had tried pretty hard in the week before to get information out to the public. I think we were kind of seen as the last game in town, and I think that might be one of the reasons we had as many applications, one, and then more importantly, why some applications that we felt probably were better suited in other RSFs came to the attention of our group. I think it's because people had heard that there was an application opportunity, and maybe not knowing where else to go, or maybe the other deadlines having passed, we were the last game in town, so to speak. So I think that's one of the reasons we might have had a number of these that we got. But overall, it was a pretty strong group, and as you went through, they were varied. There were a lot of different things in them, but there's obviously need out in the community from a variety of perspectives, and so I think that's what I would say.
This is Sarah. Maybe one question I had for Steve and Diane that I think might be helpful as we walk through this, and Daviana, I might ask if you scroll up just a little bit so people can see the rest below merchants, like of the tops of the ones that were funded and not funded. And then I guess if you could talk through, there were lots of there was a Lawrence Restaurant Association application, and then there were a lot of individual little restaurant applications. Could you just talk through how you tried to sort those out and how that went from there?
I'll jump in, and then Steve and Jasmine can add. Really, what we were trying to be driven by is the scoring of all those 5 elements that I mentioned, and really using that information to break it out into a high, medium, and low category. We didn't spend a lot of time then going back through the highs and trying to weed them out on any other purpose. We just wanted to forward them on based on that scoring. And again, Steve and Jasmine might have some additional comments.
Yeah, I might just mention in particular, in reference to the Lawrence Restaurant Association, which made several applications. We had conversations prior to the application deadline with folks within the Lawrence Restaurant Association, and understood that they would be making application for a number of the organizations within theirs, but there would be some of those restaurants, some of those businesses that would be making their own PP application separate and apart from the bundled group. Like if there was a specific set of circumstances on it with a restaurant, they may make their own. And so our understanding was that those were separate, that those that were done by the Lawrence Restaurant Association captured those that had kind of submitted into the consortium effort, and others that were standalone were either their own explicit applications or perhaps an application for something that was not included in any request they had submitted through the LRA.
And I guess I would say too, I think this is one of those examples where the scalpel may be further needed and or conversation. I think, and a question I anticipate getting from the commission is, you know, why 23rd Street, Lawrence Beer Company, and merchants and not the rest? And is that consistent, or does the commission want to just do something else, you know, through LRA? I just can envision that that's going to be a conversation they're going to have.
And this is Bonnie, and I don't want to get into the minutia, but Diane and Steve, would the beneficiaries of any funds received through the association only go to those association members? Because I know a lot of restaurants aren't members.
This is Steve. I don't know if I have specific information, but I know that at least we were told that there was intent to reach out to a broader set of restaurants beyond the Lawrence Restaurant Association. How far that extended and how many of those restaurants are included in this ask, I do not know.
And I might add, Bonnie, in answer to that question, for example, on the Lawrence Beer Company, we did note that they specifically called theirs non-LRA expenses. So they were, it appears, being cognizant of submitting expenses that wouldn't be covered by the Lawrence Restaurant Association. The question as to whether the Lawrence Restaurant Association was only going to be benefiting their members isn't entirely clear from their application. It did not say that it was only going to be their members. There were some of these, for example, some of the Downtown Lawrence Association requests, they specifically talked about it being for DLI members, which also are not all of the downtown businesses. But the LRA request was not that specific. And those are kind of some examples of, we just didn't have enough time to dive in and get some of those details. Although I will say, I think the part of the reason why we've seen overall so many restaurant requests is, again, given that that is such a significant sector that's been particularly hard hit by this.
Yeah, thank you.
I guess I want to talk a little bit through the decision from the county's perspective to take a couple of the highs that were recommended and cut them out. And I don't want Daviana to get the slings and arrows from that process necessarily. So I'm willing to talk through it. And the first of which really comes into the Lawrence Restaurant Association COVID testing. So this is, the Lawrence Restaurant Association asked for $900,000 to test all of their workers, I believe every 2 weeks. I felt like it was important. You're gonna see in RSF2 that the LMH Health has asked for $2.7 million to do community-based testing. So while that may not, and I think that this is an issue that we need to talk about as a recovery coordination team, and it's definitely something we're thinking about in terms of unified command. I'm not sure restaurant workers, as much as they are engaged in the public, rise to the top of the list to receive testing every 2 weeks. I do not believe 2.7 million is enough for LMH Health to test every member of this community every 2 weeks for the rest of the year. So we just cut that whole request. When I spoke to Emily in advance of this, I advised her to work with LMH Health and Public Health when coming up with their request. So like, that's the reason why we cut that one. As I really feel like we need a community strategy on testing that's led by doctors and science, not by people who just want to get tested. And that's why we did that.
And Sarah, this is Diane. All those things make perfect sense, and those are some information, for example, that RSF really didn't have. So I'm very glad that all these things are being looked at with that eye.
Of course. And I'm not, yeah, this is not to be critical of how the RSF ranking process came out. It's just simply when we were trying to get from 50 million to 25 million, these were some of the considerations we took. And I would say next on the Lawrence Restaurant Stimulus Program, so this is where I really feel like I also need a scalpel, not a machete. However, the way that this program was pushed forward, and Daviana, you could even maybe click on 4B so you could see that for folks. This was proposing to do a similar program to what the Restaurant Association did earlier this year in terms of schools. And they had looked to work with Just Food to perhaps partner on delivery. I have these, there are some real concerns with this. I think in terms of, if we're really counting this as a feeding program, this is not the most cost-effective way to feed our community. If it's an economic stimulus program, I guess my question is, let's just make it economic stimulus. Do we need to like buy gift cards for meals? You know, it seemed to be a bit complicated. I would love for a chance to, and my hope would be between now and when the commission adopts this, we could have a more precise and detailed conversation about what we do, because I feel that there is a need here with restaurants. That program seemed really complicated way to sort of prepare restaurant quality meals and deliver them at a higher price than what we can feed people at, and or gift cards. So but I do know that that was a big chunk, and these folks need help. And I'm open to questions here on this. If somebody feels like we've got this wrong, this is what the intent of this time is. So I would like, what we have made notes is that we need to go back in and talk about something there. I anticipate that will be a concern. And I think it goes beyond saying, I would just really ask that people, while this is being recorded, but people not necessarily go out and call Emily Peterson and tell her like what we've done at this point. This is really just a draft while we work through this with the commission, and that we know there needs to be work here. I'd say the other one that we cut out, and I think that there's definitely room for some conversation about this, was the hotel COVID aid response program. I'll be honest, this was a big chunk. So it was a relatively easy way to make a cut and not necessarily impact a lot of folks. And I know Jill Jolliker's on the line. For those of you that were engaged in Unified Command all along, know that we had some real struggles getting particularly some of the hotel providers on this list to help work with us as a community to help solve congregate housing issues that we've had over the last 4 months. So to me, it was just one that at this point in time with the machete we could cut out. I'm totally willing to have more conversation about that, but that felt like I don't know, maybe I'll just have Jill say some thoughts on that.
I think Sarah said it. I mean, none of these, we had no luck with any of these organizations working with us when we were desperately trying to find a hotel to work with us and accept money to shelter folks that needed to have a space to quarantine or isolate in. We were willing to pay for it. The hotels that did end up working with our community partner agencies, they're not on this list. So I see no reason why we would want to support these. I'm not saying that, if we're looking at the use of these dollars in response to COVID, I don't think that falls in line.
Any questions, concerns, thoughts? I would say, and maybe Daviana, you can scroll down a little bit there. I do really feel for Diane and Steve and Jasmine and Paula with this process. There were some really great applications in your medium pile that really, I think are hard at this point to talk about. I would say that I do anticipate the commission will probably have some questions about the historical heritage organizations and that work. I think I just would say that this was a tough list.
I think as Steve said, I mean, it does show the amount of need that's out there, which is a lot, especially given that we weren't able to achieve the kind of outreach really that we wanted. My guess is that if we had more time for people to apply, we could have seen this list, easily be 4 times what it is. I was surprised there was a number of sectors that we didn't even get one proposal from, barbershops or any of those kind of places that I thought would have definitely been affected, and I would have presumed we would have received something, but that sector, for example, is unrepresented. We have been trying to make sure that folks are aware of these next opportunities with the second round of funding coming through the state, and there may be some opportunities for these businesses and some of these expenses, if they aren't covered through this round one process, to be covered by that.
If there are no questions on this one, we can move to RSF2. And I think I can pull it up because I have it, but let me let me get it open for Beth and Tracy. I do want to say, like, as a mode of transition for RSF2, another theme and area that we need to do work on, and Beth and I have visited on this, is long-term care facilities. As you see, there were a couple that submitted their stuff in RSF1. We had some submit, we had one or two sort of fall in between. You know, so I want to talk to Beth offline, and I'm concerned because, like, we have some organizations that have asked for a lot. They are getting some funding in round two, but we may need to put in a pocket of funds that would be eligible for all long-term care facilities in Douglas County. I would just know that it's not where I want to see it right now, is long-term care facilities, but so please know that. All right. So,
hey, Sarah, this is
Yep.
Jasmine. Just
Oh,
before
sorry.
we move on to this next one, I just wanted to get clarification around next steps for RSF1. For that scalpel work, is that the work of the county now, or is it back to RSF1 to do more work on that? What's your direction?
I would love to particularly with RSF1 on this one to help with that scalpel work. I don't know, on 2 and 3, we may not need it as much. So yeah, I'd particularly like to partner with you guys to sort of help see if we can find out more about what we've got going here. And then obviously, I think the commission will have some considerations as well.
Thanks.
I wish I could be more precise than that, Jasmine, but I'll take all the help I can get. All right. RSF2. So can you all see that?
Yeah.
Beth, maybe I'll just turn it over to you to kind of talk through the process you guys used.
Yeah, I'll start us off, and I particularly want to let Tracy talk about surveillance testing and the role of public health and LMHH in Lawrence Memorial and in that for the community as a whole. So we took an approach. We got to start in a different spot, and that's that round one was looking at health and healthcare as a priority issue to mitigate and care for COVID-19. So right off the bat, our prioritizations open with that they opened with that general assumption. So we defined high as direct COVID healthcare and support, and that broke out in a couple of different ways, but that these were essential healthcare roles to care for our community, and specifically with respect to COVID. Further, we looked at medium as where we got into more precise COVID care systems. It was a general question of, is there a lead organization that really, coming through RSF2, is responsible for this system of care and even budgeting. So that's where we would, to stay with the surveillance testing example, that's where, as other members of the health continuum and other non-healthcare organizations where we were aware of surveillance testing in particular, we looked to have, we even changed that expense item through RSF2. It got larger, presuming that that would be centralized and coordinated through LMH Health. So that was broadly how we looked at medium, even within our own RSF2. And finally, low was where they were things that really weren't directly associated with COVID's impact or care delivery systems in our health continuum. So that was the broad stroke. And I think that I just want to reiterate what Sarah said about long-term care and where those organizations were or were not. We only had one that submitted within the deadlines and processes of this RSF2's organization structure. We also, what we understand is that licensed nursing homes, that does not include necessarily assisted living. And some of the other places where you have vulnerable, disabled or seniors that are in congregate living. So that's where, just to reinforce what Sarah says about understanding round 2, and where there's within that 120 days of $20 a day of all expenses, really understanding who's included, who's not, and how that impacts takes some doing to figure that out. Finally, I would just say, when you look at this total, and it appears that we're also just kind of looking at, but where the county was, we do have, we additionally, one more point on additionally, you all will recall that we asked the logistics section to come up with a PPE purchase for those organizations that are, we understand have a recovery role and in the community with PPE purchases. So Charlie worked with the logistics section to come up with a gap amount of money, if you will, or safety net, because we didn't have the opportunity to see every organization's evaluation of PPE through all of the RSFs. So we're carrying a $207,000 PPE line item that was based on the tracking and the use rate evaluation to date that logistics has been doing. So that was passed through with RSF2. What you'll see is it appears that all but about $750,000 worth of our requests are being funded. Half of that is Heartland had presented a mobile van, and the public health department, in their primary role of outreach and outbreak control and testing, is being funded a mobile van. So one mobile van is covered in the county, not 2. Another part of funds where Sarah was trying to evaluate against our direct aid was, where did we have equipment requests or expansion that was really not directly related or impact by COVID in our core healthcare providers. Tracy, you want to add to that around the testing, design, and surveillance?
Sure. We had I couldn't name for sure all the ones that also had put in for testing at their specific areas. So we took all of those amounts and added on to our surveillance. And kind of like what Sarah was saying, we included, it was just medical facilities and healthcare workers and first responders in our surveillance. We did not include, everyone in the county, because the amount we asked for still would not be, enough for that. We also, looking at that surveillance, testing, if we would go to a different method of using, of testing anybody that would like to be, those testing results, they're done differently by using saliva and things. So we looked at all the various ways of testing. And then we also put in that the vaccinations and how we could give vaccines to the whole community and coordinating that. So trying to look at the community at the whole and what that need would be. So some of the individual requests were added into our total amount for surveillance. So we will see that. But of course, you know, the way things are changing, you know, you hope that that's enough money. You just don't know. And also, it also relies on us being able to get the supplies to do that surveillance. So.
Oh, go ahead. Go ahead.
I didn't know, was there anything else you wanted me to speak about, Beth?
No, you know, I think one of the things I just say to the whole group in healthcare and public health space is this grant gets us through December. So there are other state and federal grants that we expect and some that we are applying for that get us into 2021. So the whole notion of expanded testing, the staff to go along with it, or you know, vaccinations as we partner with LMH and Heartland in those kind of endeavors, that's future. And that's future funding, and those aren't even, you know, projected in 2020. So this is kind of the beginning and the infrastructure and getting resources set up to augment the systems we've already put in place. And it is a big number. And obviously we appreciate the, as all of us together are looking at this domain. And we too required an equity impact assessment that was provided by all the organizations, and as an RSF2, really spending the time to look at the impact that we're saying we'll be able to make with these dollars, with this big investment of money. That is going to be an ongoing conversation, and we're going to look at the collective summary of those at our next meeting to keep working with what we said we could do for our community.
One of the things I wanted to also, along this whole topic is, you know, I think like Tracy, I just think we need to probably elevate and promote what that surveillance and testing strategy is going to be, you know, because, you know, everybody thinks they all need to get tested every 2 weeks. And I really want that led by doctors and science. And so, and we need to not blame LMH on that. Like, why isn't there just enough tests? Like, we need to elevate the fact that this is the best strategy right now to keep our community safe. And that some folks are at a higher risk and some folks are at a lower risk. And they may, even though they're at a lower risk, it's not no risk. And they may feel like they're at a higher risk, but we have to prioritize some of this.
I think, good point, Sarah. I also think that, you know, with surveillance testing, it also goes along with the vaccination, having to prioritize who gets the vaccinations first. I think all of those things will have to have a great plan, and the physicians, of course, need to be the ones leading that, because I think, you know, that is hard to make those decisions. So.
The other thing I would add to the important point Sarah's making is that the county, within the PIO team, they are looking at, on an ongoing basis, how we use all those communication portals and professionals to help reinforce what Sarah is saying. And we are carrying in the health department budget a sizable amount of money to support public communication messages that are essential to COVID mitigation and helping to address the expectations of the community. And that certainly includes the continued effort to manage testing and vaccination, along with safe behavior, which is where it all starts. So just to say, there is funding to support those endeavors that George and others have been working on.
Other questions on round two? I think the sheet's pretty self-explanatory. Okay.
Sarah, I had just one question I know we're setting a testing strategy. So does that $2 million for that include not just the healthcare agencies that were in RSF2, but if the strategy determines that there are other communities that those would be included in that 2 million?
I mean, I would let Tracy respond, but
Yeah, it would, but it goes back to Jillian, we're still gonna have to rate that. Because $2 million, it's $50 a test. You know, for us to test everyone in the county one time, we wouldn't even be able to do that. So
yeah.
Thank you.
Yeah. I don't think we should send them. I think we should send the message that we have a lot of money in here for community-based testing and surveillance testing, but that doesn't necessarily mean anybody who wants a test can get a test whenever they want it.
Correct.
Jill, do you want to can you pop up? I can't remember what we decided to do about your screen.
I can't pop it up. If somebody would put up, if somebody would share screen for me for 3.
I can get it unless somebody
I'm
else.
sorry.
No, I didn't. That's all right. Let me make sure I have it open before I pop it up.
Thank you.
Start talking, I'll get it popped up.
Okay, so I talked about this just a little bit last week about the methodology for how RSF3 reviewed and ranked our requests. The requests were, our first frame of reviewing them was to look at them and whether or not they fell in line with the 5 focus areas that we established. We established those 5 focus areas weeks ago, and those were focused on housing stabilization, congregate living environment, shelter supports, food security, food supports, and homeless, unsheltered populations, and then digital equity and inclusion was one that we recently added. And so we looked at all the requests and whether or not they fell in line with that, and that automatically gave requests a higher rating, or they were evaluated higher. And then we looked at them in terms of, we of course reviewed them based on the equity assessments. And then we also looked at them in terms of the other layer of how we reviewed them was how, in terms of the request for PPE reimbursement and PPE moving forward, supports moving forward was agencies that we knew had been engaged in responding to COVID-19 beginning back in March when we were all in the unified command effort. And so those agencies are all reflected here. And the safety net agencies that need to be supported, we tried to prioritize them. And then the only other frame that I can think of that we looked at was just in terms of, direct response to COVID. So those were the way that we reviewed them. The recommendations that you're seeing before you are the ones that got a high recommendation, which was a majority of them. But again, we felt like the ones that are reflected in our recommended projects, direct aid requests are, they all do more or less fall in line with our focus areas. They all submitted their equity assessments and received favorable ratings from all of our reviewers, and that's where we ended up. And I'm happy to stand for any questions if anybody has them. And I don't know if Shannon's on, if she's able to weigh in at all. I don't think she's on. I know Leah was a part of our conversations, in reviewing them, and Kara, and I see both of them are on. And I don't know if either of them would be willing to or want to weigh in on how we evaluated these at all.
I guess the only thing I want to clarify on here, Jill, and it's maybe because this particular RSF3 summary, if it says it's low or medium, it was not included in that total. We have not gotten that cleaned up yet to move those to the bottom. So you're going to see some lows and mediums on here. Those are not yeah, you can see that they're not included in the total on the recommended column. We'll probably move them to the bottom like we did RSF2. You guys are going a lot easier on us than I thought you would. I guess if there's no questions here, we can move on to.
I guess this is Elizabeth. I have a quick question. So with regard to, and tell me if I'm asking a question that the answer can be found somewhere. But if I'm looking at, can you talk a little bit about what round 2 would look like specifically for this RSF and the application process?
Round 2 is at the state. So it will all be managed by the state of Kansas and different agencies at the state of Kansas. So each agency will set up their own process for application. I think there's a ton of great stuff in round 2 for things. Food system, health clinics. There's a lot of great stuff in there, but the county will have no official role in that process.
I can say too, Elizabeth, that Leah and I were, Leah Roslin and I with the United Way, were talking this morning about the county providing an update at the next Human Services Coalition meeting on what we know about round 2 and round 3, so we can make sure we're getting that in front of all these providers as soon as possible and communicating that.
Sure. And I guess I'm asking just because I see there's a number of agencies that aren't on here, and I don't know if they just didn't know how to apply or what that looks like, but are providing some pretty vital services. So when I look at things like, a $367,000, or no, wait, for a $367,000 request for capital, I'm just curious about what the intention for that is. And I can go back and look through the requests that you guys provided, but just curious how some of those other places like headquarters, who've seen a huge influx in response or in need due to COVID, just curious how they can.
Headquarters was directed to go through RSF2. So I mean, that I know I had exchanges with headquarters, and they were directed to go through RSF2 because mental health, behavioral health fall under RSF2. And I know that the headquarters folks are on the list, and
yeah, Jill, you're cutting in and out. I guess one thing I'd say is, Elizabeth, this has been a real struggle in this whole process. We had it in RSF2. You can't we had no time to make sure that every agency heard about it and had a chance to put in an application. And as you can tell, we only had 25 million and we had to cut it in half. So
Sure.
It's
I get it.
So hard.
I totally understand, and thank you for humoring me and answering my questions. I know that this is challenging for everybody involved.
No, there's no humoring. I really want you guys to feel, I mean, this isn't, it's still a great way that we have $25 million to spend in this community, but it is not, these decisions are not easy. There are a lot of great projects left on the table and a lot of great projects that didn't even get to the table. I would say that, like, I think one of the things that we didn't really talk about, and if we lost Jill, I'm hoping she can come back on.
I'm back, sorry.
That's all right. So, like, there's some really good stories out of this. Like, between the amount, I'm going to try to click on it here. I mean, the Catholic Charities eviction per, well, no, I'm sorry. The tenants to homeowners, $850,000 for rental assistance. When you combine that with what the city of Lawrence has put in their direct aid proposal for utility assistance, and the city of Eudora and their utility assistance, on top of the funds we've already received from the state through ESG funds, this is tremendously important work to help provide resources for people at our very margins. And I think it will provide a ton of success through this. So while I know this is really hard, like, that is real money that we've not had in this community for homelessness prevention in forever. So, and the ability to make capital improvements to our shelter that are desperately needed so that they can keep the people there safe. And we're combining that with the CDBG funds. Like, I'm tremendously excited about this list.
What I would say again is that each have all some
We can't get you, Jill. You're just cutting in and out on us. If there aren't any other questions, we can move on to 4. And that is Jillian. Gonna pull it up for.
I think, Andrew, were you going to say a few things before we get started?
Is he back? I think he had to step off for another meeting. This is Julie. Our group very much struggled with the prioritization process, feeling like that we did not want to define the educational organization's priorities for them. So what we, after quite a bit of time discussing it, we decided, in the interest of needing to get it done, that we would ask the entities to rank high, medium, and low their own priorities based on their equity tool and their direct tie to COVID. So that's what we ended up with in terms of a process.
Thank you, Julie. And I'll go ahead and start, Jillian, if you would please chime in where you see necessary. But so we got this Friday afternoon, and we worked on it late and then into Sunday night to, because it came to us prioritized by each organization. We looked at it in a way that we had to make recommendations in that we took the look of primarily based on safety, equity. We considered each request with mitigation in mind, schools opening in person, and an increased need for childcare. So that was our perspective as we went through this. Most of what you'll see as recommended is on-site PPE, social distancing measures for the USDs as well as some of the colleges. Very few recommendations for technology are included in here. We started at 7.3 million, and we came in at 3.8 million in the spreadsheet you'll see here. You'll also see back there at the top, Boys and Girls Club and child, if you want to go back, child care aware, that the importance of not only the increased child care need, but equity in the community and trying to get those kids in places where they need to safely be. We still are having a conversation with, there was another request for the Boys and Girls Club that we're trying to get clarification on. So again, this is still a work in progress. We did work out the, if you go down there to the bottom, you'll see, can you scroll a little bit more? Yeah, the O'Connell Youth Ranch, we got some clarification this morning on their request to ensure that it was directly tied to COVID, and it does seem like it is. So what you'll see that's not colored there and down below are the things that we didn't include in our recommendations. And then I think if you go all the way down, you'll see a couple that we, or did we have any that we didn't think would make it at all? Or do we, I think we mitigated those as well. But yeah, that's kind of how we looked at it. And Jillian, tell me what you would add to that.
I think that's basically it. There's a few places in here, like you mentioned, equity. So there is some technology for providing access to students that didn't otherwise have access to internet. So that is included in there, which was slightly off. There is some behavioral health support that was also included. That is just, again, slightly different than that overall mitigation, but we included that as a priority as well. You'll notice here that there's a lot of PPE and sanitation. And what Sarah mentioned earlier about, HVAC systems and that part, those are not necessarily included in ours. But again, as Robert said, this is a work in progress as we try to be consistent across all of the requests as much as we can. To meet the community, there's a lot of stuff that's not in there. We realize that it's still a need, and it is a high need. We just thought to focus on specifically how do we mitigate the spread of the disease where students and faculty and staff and personnel are in the same space, and to ensure that continuity for childcare, daycares, in that learning process. So I think that's really our overall thought and recommendation.
We would stand for any questions or conversation about these recommendations.
Okay.
This is Beth. I do have one question, Robert, just from going through there. So would you all, one of the things we grappled with or had some just general conversation about was, I see you're carrying some financial support for daycare, but in this group, did you have any discussion around, is there a system to even provide enough people to mitigate home care, in-home even care needs as we reopen the schools? Is there a systemic solution to that big question?
Yeah, that's a really good question, Beth. So, not knowing where Unified Command will be when, that topic came up yesterday, obviously, we talked about at least got that conversation started and some work to be done around that. In theory, these proposals here where you see childcare, it's, when you read them, they're telling us it's through the end of the year. That doesn't even get you into, spring, so I think more to come on that as the work and Unified Command goes. But if this is some help between the Boys and Girls Club and Child Care Aware to at least get through the end of the year, then that's probably the best we can do. So,
and Beth, so for the Child Care Aware, one of them is financial aid to individuals to cover childcare costs. I don't know if it's specifically, it doesn't really show a whole lot in this one. And the other is funding for some sanitation, cleaning, those types that are going directly to the providers for the Child Care Aware, some of those grants. So it's a mix of both, trying to support overall throughout the community. That may not specifically answer your question, but it might provide a little more light.
Thank you. I just know it's a giant issue, and I'm sometimes hear people say we can't even build the infrastructure to support the demand. So I've just kind of been waiting to see what this group came up with. So thank you. I'll read the details. I'll do my homework later. Thanks.
This is not meant at all as a criticism, but I think speaking for the educational organization that I am a part of, would place more priority on learning resources than on the PPE and sanitation. It seems like there would be an easier, better, cheaper way community-wide to get those needs met versus each organization buying those separately, as it looks like that's the plan here. And I think that our organization at least would place a higher priority on education. But
and
neither here nor there.
Yeah, thanks for saying that, Julie. And one of the things that we did talk about is the unknown for all the USDs, and that like 497 is going to go the first 6 weeks virtual, but we don't know what your school board is going to do from there. We don't know what the other school boards are going to do, and so when you think about having to prioritize, and when you think about it in a worst case scenario, is you're going to bring kids back together. And if you can provide some help, financial help, and some resources to mitigate that danger in spreading the disease, then this is concrete. This is directly tied to COVID, and it is some help. I agree with you. Those technology items they're big ticket items, and yeah, it would be great if there was a way to combine that together and come up with a plan to for all the USDs, or to buy a system or come up with a system for online learning. But that's kind of how our conversation went when we were considering those technology requests.
And Julie, to add to that, some of the questions that we had as well was the other funding, and not knowing exactly how that funding would be provided or allocated, or the specific use cases for some of the other funding that might be available as well. That was also kind of a question of, what else might be available. Because yeah, we absolutely hear you on those. And it was really a difficult conversation that we went back and forth for a while on. So thank you for also highlighting that and elevating it.
So Jillian, if you want to not share, I will go back to the summary tab. So at this point, all the RSFs and the municipal direct aid plans come in at 22.9 or 23 million. There were reimbursements recommended of 1.99 or 2 to get us to this amount. We are under by $17,955 at this point. We still have a lot of work to do on this. So I know that we've got things that will have to come in and out here. So I'm sure we will spend to the penny, but I don't feel like we're at that point right now where I can allocate that out to someone, because we've still got a lot of things to work out. Any thoughts, reactions, concerns?
Sarah, this is Casey. Maybe if you could talk a little bit more about the sort of starting with the reimbursement requests, and the criteria you used or thought process behind reducing those requests before moving into the direct aid. I thought originally when we kind of talked, it was
the reimbursements would get addressed, and then whatever was left would go into the direct aid plan. I'm not saying one's good, one's bad. I just was curious what the thought process or rationale was behind that.
I would just say that, you know, that was our original intent. I think I was concerned about the consistency between some agencies asking for reimbursement and for payroll expenses and some not. Obviously, if that's, I mean, it is totally an eligible expense. So there's no question there. We could include them back in, but then I've got to cut $600,000 from somewhere else in the program. So I did that based off of what I think the commission is going to want to see these funds move to the community more directly than another $600,000 off the table. But if there's, I mean, I know that like there may be things in direct aid plans. I mean, we funded entirety of direct aid plans for like the city of Lawrence, you know, so if there's, I mean, and like I said, this was a machete, not a scalpel. So I'm, if there are preference, I think we could have that conversation. I think what I would point out to the commission is, you know, there's a lot of payroll, and I think there were different layers of payroll requests inside the city of Lawrence. There were some that were providing both the state and local FEMA match, if that FEMA match ever comes, versus time spent on unified command versus reassignment. I did not have a lot of time to get into a detailed conversation with the city on how we should approach that. My hope is we can do that now, though, before we finalize this.
Sarah, this is Diane. I just wanted to ask about how we could answer any inquiries that may come from applicants through our respective RSFs. I know that you touched on, you know, that you weren't ready for us to call those applicants, et cetera, but what can we point them to as the next steps? And will all of the materials that the RSF forwarded to the county be made publicly available? And where should we point them to if they have questions about next steps?
So yes, all materials will be made publicly available. The next step is to walk the county commission through this, just like what you all went through, tomorrow at 5:30. We will not have the materials online before that meeting because I want to try to get this all clean and try to answer any questions as much as possible before that point. Our county staff have got a lot of work to do in between now and then to make that happen. But it will all be made available. The county commission will not make a decision Wednesday. They will not. They will, I know they'll ask questions. I'm sure they're going to send us to go back to either RSFs or directly to organizations, ask for more information, and discuss and try to find out some answers for them that might be helpful for them in evaluating their proposals. The meeting tomorrow will be on Zoom. All the information's on our website, so you can certainly listen in. It's the only thing on our agenda because we had planned to cancel this meeting, but we're holding it for this purpose. And then we're talking about, I've had a request to try to meet in person for the 12th for the adoption. I'm working on that. I'm trying to make that happen. I don't know if I'll get that, but then all of this information will be put out publicly before that meeting with a recommendation with where we are. I would say that for the meeting on the 12th, putting it out there, we are trying to compile it all together and try to make it somewhat readable. But when you're trying to include all the equity forms, because they're not in Excel, it's real clunky to read through this. We're going to try to do some sort of, I don't know, I'll be lucky if we get a PDF pulled together that sort of gets this. I'm not sure we can leap that tall building in a single bound here. We may just put the equity request separate. There is some cleanup work that we have to do here. because, you know, some folks went ahead and gave us their EINs and social security numbers and their proposals. So we gotta make sure that that's all scrubbed out so that it is safe for consumption. Is that helpful, Diane? Is that enough?
Yes, that really helps us because I'm sure that that question will come up. So that gives us what we need to outline for people to stay tuned. Thank you.
Yeah, I mean, like I said, we've still got some work to do here. So I would just anticipate that there's going to be some modifications between what we even show on Wednesday and what the commission discusses and what gets approved. So I know, like, I'm pinning you guys down here, but and I'm a big believer of silence is acceptance. But in trying to be reflective of equity, and I would really like to hear if you're comfortable with this, or I definitely don't want to hear afterwards that you're uncomfortable with it.
This is Craig. Sarah, I really appreciate that. That's a position we're frequently in, aren't we? Crickets and then outrage. But I can give you my feedback is very positive. There's been unbelievable work that's been put into this, and I think the balance, you know, in my humble opinion, is pretty good. And you know, I'm very proud of the equity work that, you know, we put that lens in an early stage. I'd like to see some of that kind of quantified, because it looks like the way each of the groups put equity in there was kind of high, medium, low, or there's some indication of that. And I think it's good. Our community should hear that we've done that and show that these dollars are allocated in a way that had a high priority on that. So that's just a suggestion. Also, I like pie charts in this. You know, you slice the pie up. So I think that would be a good way to show how we prioritized and you know, just somehow all these four groups coming together, to me it looks very thoughtful, and it looks consistent with, I think, our priorities going into this challenge. So I'm very favorable to that, and I'll go all the way back to even conversations that you and I had, that this is an opportunity to, of course, address what we need to address with this. But also that there is some really important residual capacity building that came out of this. And I see pieces of that throughout, in addition to just the way I think we as a community have come together to do this, which those are social capacity assets that I'm really proud of as well. So I just say wow and awesome, and thank you. And of course, there are going to be little pieces that could have gone a different way, but I think as far as what we've done, I'm very impressed and proud of the work that was done by the group, and I'm very thankful.
Those are excellent comments, Craig, and I echo them as well. I am looking at some of our businesses that are hurting so much, so I think our work is cut out for us as well in terms of promoting those needs in round 2. So we'll be working hard with the state and in other areas to let our businesses know that hopefully there's additional funding that will help them survive and get through this crisis as well. So I think that's a message that, you know, at the chamber and others that we'll be sharing, and I hope others will share that to your audiences as well.
To that end, I do think the next piece of this, once we can get past this piece, would, you know, I'd like us to talk, you know, about how do we collectively attack round 2. And, you know, I think there could be some really good brainstorming and problem solving as to how to do it. It's very, it's not the same thing as this where you could just put an application in and it goes. Like, it needs to be targeted towards a particular, area and focus. And, I know where county stands to be a partner in that process, help identify projects, to help promote them. We're actively following all of this work because of how big round one is to the county. So we can share that expertise. I know Brooke is on every webinar on everything ever. So, we can help prepare some of that information and get it out, and really just stand to partner with people. And like I said, I think it's important just to reiterate to folks on this call. So the way this works is, even once the commissioners approve it, their recommended plan, we send it to the state. The state may also cut things out. In fact, I anticipate they will. So what we will also then develop is what I'm affectionately referring to as the honorable mentions list. And that we will prepare to have a backup if something gets struck. And I would just say, please know that, like, I think there are some things on this list that might not make it. Everybody, the JV list, I like that, Sonia. That everybody, I mean, they have really been honest that it has to be tied to COVID. So even like I had part of my conversation with Casey on the equity work is, like, we have to tie that to COVID. Not that just like equity is great to do anytime. It has to be tied to COVID. So I think, like, I may come back, and we've had some conversations about distance learning, that they really only want distance learning for schools. So I want to read, like, the Art Center proposal a little bit more clearly, to make sure that it doesn't say things that should be only eligible to schools. So if we see, like, catchphrases or problematic words that we think are going to hurt our application, please don't mean that we're trying to be mean. We're just trying to make sure we have the most successful application when it goes to the state, because ultimately it's their call.
So Sarah, this is Beth. When the state does that, if they cut something, am I hearing that you will then have the opportunity to resubmit something else from the used cache of programs that we have?
Yes. And so
Okay.
ideally, before we get too far down this process, we will kind of try to identify what some of those priorities would be if something gets cut. But remember here, I feel like long-term care is a big question mark in this, and I gotta come up with something in that place. And we have work to do.
Okay.
Thank you all for, all the tremendous, I can't like the work of the RSF coordinators in this process. Thank you so much. You all did not know what you were signing on for. And I appreciate you continuing to serve and help us with this process. Honestly, I was so impressed at how everybody did this work. It went so much, it really went pretty well. And I'm proud that each RSF was a little bit different and responsive to the needs of its particular RSF. So thank you so much for your time with this. And you have the same spreadsheets I do now. So if you see something and you want to talk about it, please feel free to reach out. And we want to try to make this something we can all at least support.
Thank you, Sarah. And for the purpose of meeting times, are we going to go back to a once-a-week meeting?
Yeah, were we going to go to every 2 weeks for this group?
Every other, yeah, that's what it was. Every other week. Yeah.
Yeah.
So we want to go back to that, or stay here for now for another week.
I'll do what the group wants.
Let's stay one more week and then go to every other.
Perfect. Thank you. Sounds good. That's what we'll do. If nobody has anything else, then we'll get that on the calendar. And thank you for your time today. Appreciate it.